How is bladder pain syndrome diagnosed? Imagine trying to solve a puzzle where no single piece gives you the full picture. That's often how doctors approach diagnosing bladder pain syndrome, also called interstitial cystitis. There isn't one simple test that can confirm it. Instead, healthcare providers use a combination of methods to piece together the clues from your symptoms and tests to make an accurate diagnosis. This careful process helps rule out other conditions that might cause similar symptoms, especially bladder cancer or urinary tract infections, which are important to exclude for bladder health. The first step is a thorough medical history. Your doctor will ask about your symptoms, like how often you feel the urge to urinate, if you experience pain or pressure in your bladder area, and what makes your symptoms better or worse. They'll also inquire about past bladder issues or other health problems. Following this, a physical exam is performed. For women, this might include a pelvic exam to check pelvic muscles, while men might have a digital rectal exam. These exams help identify any physical factors contributing to your discomfort. Your doctor might ask you to keep a bladder diary for several days or weeks. This involves recording how much you drink, how often you urinate, and the volume of each urination. This information provides valuable insights into your bladder habits and symptom patterns, helping guide treatment options later on. To get a clearer picture of your symptoms, healthcare providers often use standardized questionnaires. These include tools like the Interstitial Cystitis Symptom Index or the Visual Analog Scale. They help document where you feel pain, how intense it is, and what triggers it. This detailed symptom assessment is key to understanding your condition better. Laboratory tests are also essential. A urinalysis checks your urine for blood or white blood cells, which could indicate infection or other issues. A urine culture helps identify bacteria causing urinary tract infections that need antibiotics. Sometimes, a potassium sensitivity test is used. This test involves filling your bladder with a potassium solution to see if it causes symptoms, based on the idea that a damaged bladder lining might allow potassium to irritate the bladder wall. However, this test isn't used universally. In more complex cases, or when the diagnosis isn't clear, additional procedures may be needed. Cystoscopy involves inserting a thin tube with a camera into your urethra and bladder to look inside. When performed under anesthesia with water filling the bladder, it can reveal specific signs like Hunner lesions, which are characteristic of some bladder pain syndrome patients. Cystoscopy also helps exclude other problems such as bladder stones or tumors. Urodynamic testing measures how well your bladder stores and releases urine, helping differentiate bladder pain syndrome from other bladder issues like overactive bladder. The key to diagnosing bladder pain syndrome is confirming that your symptoms include bladder-related pain along with frequent urination and urgency, and that no other disease explains these symptoms. This means other treatable conditions, especially bladder cancer, must be ruled out first. It's important to understand that bladder pain syndrome itself does not increase your risk of cancer. The process involves careful testing and evaluation, and sometimes more advanced procedures are used if the diagnosis remains uncertain. Ultimately, your healthcare provider will tailor the diagnostic approach based on your specific symptoms and medical history. Working with a specialist experienced in bladder conditions ensures an accurate diagnosis and appropriate treatment plan. Remember, if you experience symptoms like bladder pain or frequent urination, consult a healthcare professional for personalized advice.